Hello, my name is Michael Savoldi. I was a Farrier science instructor for the Animal and Veterinary Sciences at California State Polytechnic University in Pomona. I was also the resident farrier for the W.K. Kellogg Arabian Horse Center, which is located on the Cal Poly campus. I would like to discuss a few things about pathophysiology of the equine foot. That seems like a long word. So let me break this down. Pathology is the study of disease, and physiology is the study of living organisms and their parts. Our topic today will be altering the plane of the PIII bone. The take-home message is pathology can be based on the plane of the PIII bone. So let's start off with two important areas, the plane of the hoof capsule and the plane of the third phalanx. The plane of the hoof capsule is set by the trim, or how the foot naturally wears. We're looking at a foot that has been trimmed to the sole plane. This is a trimming technique that identifies the true foot of the horse, and it is based on anatomy. The plane of the third phalanx is set by the sole arch and combined with the trim. So for simplicity, we can horizontally plane a hoof capsule based on how it's trimmed, but the plane of the PIII bone is subject to the movements in the arch. So as the arch collapses, then the bone position will lower into that area and be altered within the capsule. The distal phalanx. This bone shows a very level edge coming right along this area through here. This would be ideal if we could learn how to maintain the level edge of a PIII bone, but it's subject to disease. When the bone becomes inflamed, Phalangitis develops, and that will demineralize bone and cause a lot of problems for the animal. Another area is the heel area of the distal phalanx, and we can see that it's remodeling. If we look up into the right-hand corner, we can see a juvenile bone, or a very young bone. Starting on the end of this bone would be ungual cartilage. It moves out, it will wrap around and come back and attach to bone. And if you notice, this is clean, where our example has a lot of developing tissue due to stress to the ungual cartilage. In other words, when the ungual cartilage is under stress, it will lay down fibrocartilage. If the stress isn't relieved or removed, then it will start to produce calcium and will make the cartilage very hard. It's natural for the bone to protect itself. So we have very early stages of side bone developing in this foot. Here's an interesting bone. If you look at the upper left-hand corner, we can see a bone that has a full toe, and it's a full toe in this area. Now I have to say that in detailing this bone out, there is some Phalangitis taking into the toe. That's just naturally occurring. There's things in this foot that are naturally occurring that we have very little control over. But in our example, you can see that this is not a full toe. There's a space. So there's bone missing in this area. If we were to place the bone on a lateral view and on a level platform, we now can see how much bone is missing. So we have the advantage to do a pathology grade on bones in this area. Now, why is this bone missing? Well, let's look at Wolff's Law. Wolff's Law. Bone in a healthy person or animal will adapt to the loads under which it is placed. Well, let's look at this bone on a horizontal plane. The bone is missing in this area. Well, how could it be missing if it was placed on a horizontal position? It needs to have some type of force applied to the bone for bone to remodel. So let's look at the bone position within the foot. It had a lot of pressure put on its toe. In other words, if we were to look at this foot, it most likely would be in a horizontally planed capsule. All my work's based on a horizontally planed capsule. That way, when I look inside, I get a good view of what's happening for measurements and things like that. Well, if I looked inside of this foot, the bone would be in a very strong positive palmar angle. The arch would have a deep connoisseurs and a very flat toe arch. So this is the cause for bone reabsorption. Now, a bone can have stress in the heel area. Here we can see the PIII is remodeling and bone is demineralizing. It's starting to miss a lot of bone. Over here is our bone on a level platform with our level edge. And in this case, if we put a level platform, that bone would not be touching the platform in the heel area. And this is how much bone that would be missing. That's demineralization due to stress. If we were to look at the bottom of this bone, we can see that a lot of the cortical covering is gone, exposing a lot more of the cavities and grooves that we see in the bone. This has advanced to osteoporosis. Bones can develop from pilostitis. The next step could be osteopenia, which is a light form of bone remodeling, advancing into osteoporosis, which would be a greater form of remodeling. So now we can evaluate these three bones, and they're all on a level platform. The first thing we see is that the DIP joint or the coffin joint has different angles. This angle is more upright with the extensor process more upright. This angle is lower with an extensor process leaning backwards. I just explained two pastern alignments. This would be your upright pastern, and this would be your low pastern. This is more commonly found in front feet. This is commonly found in hind feet, but they can be in both. There's our level edge. This edge is showing pathology in the toe, and this is showing pathology in the heel. So let's see if we can explain the statement, pathology can be based on the plane of the PIII bone. So bone position on the arch. This cartoon shows a level platform. So we can interpret this as being a level sole plane. The top line has a little lift to it. It comes along and drops off in the toe. If we were to place the PIII bone on this platform, it would be horizontally planed. These two positions are ideal for the foot, but they're rarely found. First off, it's hard to find someone that knows how to trim a foot to a horizontally planed hoof capsule because it's not taught in our teachings. And it's also hard to find a PIII bone on a horizontal plane because as soon as the horse stands on its foot, the arch can begin to collapse, body weight. Gravity always wins. And so from day one, these bones are starting to remodel the arch based on body weight. Here we have a level platform, but our arch is deep in the rear half of the foot and it's sinking down or dropping down into the toe area. If we were to place a PIII bone on this foot, the PIII bone would be in a forward pitch or a positive palmar angle. I like to refer to the capsule in nautical terms or aviation terms such as yaw, pitch, and roll. I would prefer to talk about the PIII bone in positive and negative angles. I don't really like to use the word negative because people interpret that as being a bad thing. But in some cases, a negative PIII bone can be a positive part of the foot until we learn how to control it. And then we can use that for our advantage. I'm sorry, I got off subject there and that didn't make much sense, did it? But let's continue. So let's look now at a level platform with a very deep arch in the toe, but crushing in the heels, a flat, wide heel. When we place our PIII bone on this area, we can see now that our PIII bone is in a negative palmar angle and inside a capsule that's been horizontally planed. Now keep in mind that these drawings that I'm showing here, these cartoons, are greatly exaggerated. I'm doing this to show just the effects that it has on bone when bone position is altered within the foot. All of this can be naturally occurring, but it also can be man-made. But look how the joint changes, how the DIP joint changes. As the bone falls forward, the angle of the joint changes, or the extensor process, the DIP joint angle changes. As the bone falls backwards, this changes. So what does that do for pastern alignment? It greatly alters pastern alignment. So we need to concern ourselves about bone elevation and bone position within the foot because it will alter pastern alignment. It's very common for a veterinarian prescription to raise the heel, especially on this foot here. Let's raise the heel. Well, raising the heel really does an accomplishment internally. What we have to concentrate is how to control the arch. Because if we can get an arch to duplicate this or look like at this position, then our pastern alignments will improve and change. To be honest, everything improves and changes. So we can talk about pathology based on the plane of the distal phalanx. Weight pressing into the arch, a positive palmar angle. So let's start with our horizontally planed hoof capsule. Looking at a horizontally planed PIII bone. And I can lift the bone off the arch and we can see that our arch is horizontally planed. But if our bone should be in a positive palmar angle in a horizontally planed hoof capsule, and I say this, I have to stress this point, is because if the capsule is not trimmed to horizontal to its true foot, then when we look at bone measurements, our measurements could be incorrect. If this foot was trimmed and left with heels, length of wall left in the heel, that's going to put the capsule in a forward pitch. That will lift the plane of the PIII bone and change the positive palmar angle on a radiograph. All my research is based on a horizontally planed hoof capsule, sole plane. So now my work can be duplicated. And I say that quite frankly because it's impossible for me to duplicate someone's research if I don't know how the horse was trimmed or how the horse is standing on its foot. This work can be duplicated. It can be challenged. And I really wish it would be challenged because we need to work all these details out for the advancement of the horse. Health and welfare of the horse is quite important to me. So when we raise the PIII bone off of the top of the sole line, the top of the arch, we can see that the top line has changed. It's now flatter in the toe area than it is in the heel, producing a positive palmar angle. So for an example, we can look at pathology grades in the toe area. Would this horse have pathology, severe pathology in the heel? No, it's elevated. The bone is elevated in the heel, has a greater elevation in the heel, with a very low elevation in the toe, placing the PIII bone in a forward, I should say in a positive palmar angle, inside our horizontally planed hoof capsule. So it is possible to plane the hoof capsule and still have damage. Put my cursor. It is possible to be able to plane the hoof capsule, but still develop damage to the PIII bone because of its position within the capsule and how its association with that type of arch. If we should raise the heel, altering the plane of the capsule and increasing the palmar angle of the PIII bone, our pathology grade will increase. This does not have to happen, but we're setting it up to happen, and generally in time it will. So we should be aware that whenever we trim a foot to whatever trimming protocol that you choose to use, we still have to concentrate on what it's doing to the foot internally. And that's why I'd like to see our industry move to more of a modern type of farrier science and discuss these issues because they are critical to the whole body of the horse. Now, when the capsule starts to fail, we can see some severe damages taking place. This might be a case of a laminitic foot with raised heels. If we look at the foot here on the top position and think about laminitis, there would be minimal damage to the toe. But as we raise the heels, we can see that the damage to the toe increases. And then raising the heel on a laminitic foot that is weak, the bone now can really set down into the sole body, and our pathology grade will severely increase. Again, we're talking about this angle, or we should talk about this angle. Look at, by raising the heel, this angle changes. I'll talk about this in a minute, but what I want to say to this is when the P2 bone, get this in here, when the P2 bone lowers, look closely at what it's doing in its coffin joint. So if I raise the heel on this foot and lower the P2 bone, it moves. The distal border of the P2 bone has these curvatures. I don't really have a P2 bone, but it has this curve on the bottom. They're all different of the joint. So when the limb loads, raise the heel, the limb loads, it will push the extensor process forward. It's all solid, so if the extensor process is going forward, the toe is going to go down even further. So it is critical on laminitic horses, on the heel, what type of heel that you have on that horse, because it can do an awful lot of damage internally. Now we're all fixated on the pull of the deep flexor tendon. I wish somebody or a couple of people of different universities do independent studies on the pull of the deep flexor tendon and relate it to body weight of the bone that's on the capsule, because the body weight force on the P3 bone is stronger and constantly there versus the pull of the deep flexor tendon. It would be a wonderful study if someone could do that. I'd like to see 2 different universities doing it with 2 blind studies. Then you can compare the notes. So we must be very careful when raising the heel on any foot. So I'm going to talk then what I just tried to explain on bone movement. So it's common for an upright conformation, the P3 bone, to be in a forward pitch. That's extremely common. Again, concentrate on our joint, because that's as important as our toe angle and as the angle of the distal border of the bone, or our palmar angle. This is an important angle to consider in bone movement. So the bone's always descending down. I'll go back to raising the heel. It's going to have more stress on the toe of the P3 bone. Here, I keep forgetting this cursor. Anyway, so as time progresses, or in forward movement of the bone, when the bones are transferring over moving through the joint, the P3 bone can be forced downward into the toe area, flattening the toe arch. These are visuals. The arch is a visual that you can actually see on the bottom of a foot. To really measure the arch or understand the arch, you need to work with a veterinarian, because radiographs will tell you the arch. The bottom of the foot just will give you an idea of what type of arch it may have, but the veterinarian can look closely at the top line of the sole and evaluate the arch. And then as time passes, everything starts to get worse. The P3 bone has a push-pull movement in this case. In other words, the bone is never steady inside the foot. It's always move as weight goes here. As weight influences this joint, the coffin joint. As weight influences that, this bone does this. And then it has an object underneath it called the arch. And so, depending on what type of arch it has influences here. And stance. Stance has a big influence on this movement here. So, as the bone transfers through, this wants to go here. And in a lot of cases, when it's pushing down and the tissue is being compressed in the toe, it's under tension in the heel because it's pulling up. In certain conditions, it can pull the sole up and deepen the commissures. We've just developed a club-looking foot through that movement alone, by taking this type of conformation and raising the heel, pushing the toe down, seeing the heel lift, the capsule shape can change. So yes, it's possible to develop a more upright foot. And then that changes your pastern alignment based on this angle here. Because now our pasterns are probably going to fall backwards, drop backwards. So let's look at weight pressing into the arch in a negative palmar angle. We can start with our horizontally planed hoof capsule and our horizontally planed P3 bone and look at the arch, and the arch will be very close to a horizontally planed top line. Remember that this is rare to find because we have not learned how to control the arch from collapsing. Once that is established, feet will get better, and if we can maintain that, horses will perform a lot, will have a longer and a happier life. But again, I would not recommend a farrier just trying to do this on your own. You need to work with a veterinarian. A veterinarian can explain to the farrier soft tissue, stress to soft tissue, what happens when it's damaged. A veterinarian can also explain to you the amount of time it takes for this foot to recover. And the critical thing here is, which I find disturbing, is that no one tells the horse owner, your horse's foot has trouble and you have to stay off it. This tissue has to heal. No one tells them that. Because everybody's afraid the horse owner, which is quite common for the horse owner to want to show the horse tomorrow. And so they're not going to listen to you explaining that this foot is critical. And if you keep pushing it, it's going to break down. And it's just not going to be the same horse ever again. You see, a bowed tendon can heal, but it's never the same. And the same with the damages within the foot. It will heal, but it will never be the same. This foot is fragile, and it should be treated with respect. The internal portions of the foot are very fragile. We need to stand up for the horse. Hopefully someone's hearing this. But on the backward pitch, we can see that the heel arch is collapsing, and so the PIII bone will fall into a negative palmar angle. Now this might be easy to see when we talk about the bone having a push-pull movement. It might be easier to see this on a negative plane PIII bone when the horse starts doing more exercises and working harder. What happens? The toe arch can deepen, the heel arch can flatten even more, and when the heel arch flattens, it depends on what's happening to the bars. But if the bars are being pushed down and changing their angle, then the foot will get wider. So controlling the bars is another issue that we need to introduce into modern farrier science. So now we can look at pathologies graded on the plane of the PIII bone. We'll start again with our horizontally planed hoof capsule or trim to the sole plane. Our PIII bone happens to be in a negative plane, and we can see damage occurring. We can't prevent it. We have to, I shouldn't say we can prevent it. This is naturally occurring, but it could be prevented if we would give some thought and change our ideas about how we set a foot up for horseshoeing. This would be very hard for barefoot trimmers to control. Extremely hard for barefoot people to control a collapsing arch. I'm going to get an argument on that one, but all they have to do is prove to me they can change the arch barefoot, and I'll say, okay, happy to see that. I have personally seen toe arches come back, a flat toe arch come back barefoot. It takes knowledge of what you're doing. It takes time and patience, and it takes the perfect conditions and the perfect time of year for these things to change. Perfect ground conditions and certain times of the year. The foot's more changeable than in other times. But when raising the heel, we now can see an increase in our pathology grade. Why is that? Because this pathology tells us that the heel's under stress. When we raise the heel, we're moving the top of the sole into the lobe. That's not change. That's not a good thing to do for internal structures of a foot. So our pathology grade will increase. And then when the foot breaks down, too much exercise, too much body weight, heavy horses, heavy body weight, too much exercise. You see, most of the damage that I see are not farrier induced. They're either naturally occurring or the horse is just, the owner or the trainer is not giving the foot enough appreciation. So they're exercise, they're overworking the horse, foot's breaking down. Put the body weight, over-exercise, more increases damage. So this is a team effort between farriers, veterinarians, and hopefully a horse owner that will listen. When a veterinarian or a farrier says this horse should not be showing tomorrow, they're not kidding. You're making their work a lot harder and you're stressing the horse. It's funny. I'm sorry, I'm getting off track. So in other words, raising the heel in both scenarios can be detrimental to internal structures. And then bone movement, we have descending load of the skeletal system, which is moving the P3 bone into the sole body. You notice that the plane of the P3 bone is different on this. The plane of the P3 bone on a hind foot is more horizontally planed or negative planed, and they have a longer, straighter toe. That's because of stance, how the horse is standing on its foot. Why is the front foot, why is the toe looks totally different than this toe? It's short because when bone demineralizes, this is a bone of a foot that's got vertical depth to its heel, straighter sidewalls, and a bone in a forward palmar angle. You can see how much bone is missing here. You can see the curve right there. If I raise it up, pedalostitis develops. This is, well, you can't see through the light, but here's pedalostitis to show you this side close. That's pedalostitis. That weakens bone. If you look at this side, you can see that the bone is failing. Probably not getting that in focus. The bone is failing. It's weak. And so it's starting to bend outward. If this bone was horizontally planed or negative plane, so we're just doing observation, observe and compare. Compare the two different bones, planes. And that'll answer so many questions for you when it comes to how to trim a foot or how to place a foot on the ground and how to help maintain the arch, reinforce the arch. And then finally, this foot will just break down and start to crush out the heels. This is common for a lot of thoroughbreds. This is common, especially if it's a hind foot. You'll see a lot of damage on the lateral heel because the foot is the limb is standing forward like this, and what else? Is toed out. Best way I know to crush a heel. Now, if we wanted to talk about different shoeing, how traditional shoeing addresses that lateral heel, lateral being the outside of the foot or furthest away from the body. But time has so much to do with our trimming, our horseshoeing methods. If we were to put an extension or a trailer on that lateral heel that's crushing out, we've altered time. We're stopping the foot faster. That's great maybe if you want to improve the gait, but it's terrible for the interstructures of the foot. Because when the foot stops on the ground, the bone doesn't stop immediately. It's still descending. It has to bottom out on something before it totally stops, and it bottoms out on the arch. Never put a hard product into the bottom of a horse's foot, because that hard product, when the foot stops, the sole's going to stop with the capsule. But that leaves no release for the bone's body weight when it lands on top of the sole. So putting a hard substance in there is just foolish. It will destroy the foot internally. You have to have some type of material that will descend with the bone and bring the bone to a slower stop, but also the material must be firm enough. I'm not saying hard enough, but firm enough to cause that sole to recoil. Now, we can find a way to shoe horses and protect the foot for movement and still protect the foot internally. Sounds like I'm getting a little upset, but I see such craziness when it comes to farrier science. The thought pattern is stuck on books that are 500 years old or 400 years old or what. Even some of our more modern books are based on books that were written 100 years ago. We have to break this pattern and start thinking about the foot internally. This foot needs help. And it's asking us as farriers and veterinarians to help us. That's what the horse is doing. It's asking us. It needs our help. So keep that in mind. So I'd like to thank you for this lecture, allowing me to present this information to you. Again, a lot of the things that I talk about, it doesn't have to happen. But because of the workloads on the horse and the movements of the horse, we're setting it up to happen. And we just need to find ways to prevent the damage from occurring. And it is possible. So